Hello and welcome to the Ori Spotlight Podcast. I'm your host, Jason Foster. Today we're honored to have Jonathan Gluck with us. Jonathan is a journalist and author of the book Exercise in Uncertainty. Jonathan has lived with multiple myeloma for more than 20 years and has experienced firsthand the uncertainty of chronic illness and the realities of undergoing CAR T therapy. We're excited to have him with us today. Welcome, Jonathan.
Thanks for having me, Jason.
I'm excited for our listeners to hear your story. I've just finished reading your book, which I hope we can talk a lot about. Was really moved to hear and to see the kind of real humanity in which you sort of articulate your journey and really learned a huge amount. Having worked in the field for 5 or 6 years, I've had the pleasure of talking to many patients who have been on journeys similar to yours, but I thought your experience was really unique. It would be an amazing opportunity for our listeners to hear from you. So if you don't mind starting with a bit on your background, your career as a journalist and some of the things that you've done, and your journey when you were diagnosed with multiple myeloma 20 years ago.
Yeah, I essentially, I'm a journalist and an author, as you mentioned. I've been an editor at magazines like New York Magazine and Vogue Magazine. And in 2002, this whole story started that I wound up writing about in my book, which is called An Exercise in Uncertainty. And we'll talk more about that idea, the notion of all the uncertainty that a diagnosis like this brings, I imagine, as we go on. Um, but, people have said to me, why did you write this book? And one of the things that's interesting, it meshes with my background, is there are a lot of people who are writers or editors. There are quite a lot of people who have multiple myeloma or other chronic illnesses like this, but there aren't that many people who are both. And
Mm.
I really wanted to take advantage of that background and my skill set, for lack of a better term, as a writer, to tell my story in this book. So the story begins in 2002. I was leaving my office in Manhattan one night, and I slipped on the ice. And it wasn't a bad slip. I didn't even fall. I just sort of twisted my hip a little bit. But the next morning, I woke up and my hip was quite sore. And I thought to myself, well, I was 37 years old at the time, so I thought, oh, maybe
Mhm.
I'm starting to get a little older. Aches and pains. You slip a little, and next thing you know, you're at the orthopedist's office. But I gave it a few weeks. It didn't get any better. I went and saw my doctor. He took an x-ray, didn't see anything, sent me home with a physical therapy prescription. Fast forward to a year later. In the meantime, I had changed jobs. I was working at this fantastic job that I had dreamed of working at for many years at New York Magazine. My wife and I had had our first child. We had bought a new apartment, so things were going well for me. Um, but a year had gone by since that slip, and I realized, this isn't right. It still hurts. And not only did it still hurt, but it was worse. I was having trouble getting up and down stairs, getting trouble getting in and out of cabs, having trouble picking
Mm.
up my daughter. And so I went back to the doctor. This time he took an MRI, ordered an MRI. Uh, and his office called me to say, Dr. Weiner would like you to come in and talk about your test results. And I was so incredibly naive and just had nothing remotely in mind, like a serious diagnosis of the sort I wound up, getting. I actually thought to myself, well, wow, that's incredible. Like, in this day and age, this guy is such a nice guy. He's going to call me in to talk about my test results instead of just,
Mhm.
calling me over the phone. That said, the minute I got there, I sort of sensed something wasn't right. The receptionist had kind of a very grave air about her when I checked in. She immediately kind of looked over her shoulder at the physician's assistant, and they had pre-discussed this, obviously, in retrospect. Um, and the physician's assistant immediately stopped what she was doing, took me straight to the examination room. The doctor came in right away, and he said, I need to tell you, you have a lesion on your hip. And I said, I didn't even know what that meant exactly. I said, is that a lesion? Is that like a tumor? And he said, yes. And I said, does that mean I have cancer? And he said, yes. And like a lightning bolt out of the blue, I had no family history. I have no particular risk factors. Um, just like that, 38 years old, wife, daughter, new job, everything kind of going my way. And, as I say, lightning bolt out of the blue, I had this diagnosis.
Well, I think it's interesting to note. You were 37 when you first kind of got an inkling that something wasn't right. 38, very young. This is all cancer is often thought to be, a geriatric disease, and it occurs, overwhelmingly in the 60s, 70s, 80s. But there are many of us out there that ignore those warning signs potentially that are younger than those ages. So I guess a year isn't as bad as it could have been, but no doubt, um, that kind of stage of, oh, it must be fine, I'll just walk it off, is a common response that many people would have in that scenario.
Yeah, it's interesting. My doctor, that same doctor, some years later, I was talking to him again about everything I've been through, and he was saying, and I said, that twisting my hip like that was, really sort of strange. And he said he described it as an angel's kiss, because that's what alerted me. As you
Right.
say, a year was a fairly long time, but in the scheme of things, my illness was still caught fairly early.
Yes.
And if it hadn't been for that twist of my hip, who knows how far along, things would have advanced before I knew what was going on.
I mean, most people are familiar with, the standard of care for most cancer diagnoses is chemotherapy. Tell us kind of maybe that early treatment journey, what the doctor did next post diagnosis. What that first couple of years early on in the disease was like.
Yeah, so multiple myeloma, as many of your listeners probably know, typically presents, at least early on, as bone lesions of the sort that I had on my hip. And luckily, as we were just talking about, in my case, this was detected fairly early. And after a very thorough battery of tests, it was determined that I only had this one lesion on my hip and no other evidence of disease. So the recommended treatment, the standard of care in that situation is just to radiate that area locally. So my first line of therapy was radiation therapy.
Right.
Over the next 5 or 6 years, I had a couple other hotspots pop up like that, one in my ribs, one in my neck. And those were also radiated locally. And one of the things my oncologist said to me early on was that because I was unusually young in the scheme of things for multiple myeloma, he was very conscious of trying to, his phrase was, keep his powder dry, so that we didn't start using up the more powerful treatments any sooner than we needed to, so that I could live as long a life and with as high a quality of life as possible. So that's why we were going kind of one step at a time, very deliberately with radiation therapy. Around year 7, I had my disease began to advance more rapidly, and I had multiple lesions in multiple places, and my disease became more systemic. At that point, I had a form of what people either call targeted therapy, sometimes immunotherapy, 3-drug cocktail called Revlimid, Velcade, and dexamethasone, which in the myeloma community people refer to as RVD. That was my first systemic therapy, and that wasn't chemotherapy per se, but it had some of the same challenges and side effects. It was, it was difficult, not torturous, I'm happy to say, but not easy either. Um, and then, and I know you and your audience are particularly interested in cell therapies, and we'll get to that. But just to like connect the dots there very quickly,
Mhm.
I've had multiple rounds of different forms of targeted therapies. After the RVD, I had two sort of turbocharged versions of Revlimid and Velcade called Ninlaro and Pomalyst, which are the next generation versions of those original drugs. After that, I had a different treatment called Darzalex and Kyprolis, two more drugs that are used in combination quite frequently for myeloma. And then all of that stopped working. Basically, the pattern overall has been my disease crops up, they treat me, I go into remission, sometimes for a brief period of time, sometimes for a long period of time, sometimes a partial remission, sometimes a complete remission. But then my disease crops up again and I need to be treated again. As you know, myeloma is not curable, but it is, luckily, because of many advances, even in the time since I was diagnosed, um, treatable, for many people anyway.
Right.
That's what brought me up to the cell therapy in the summer of 2023. Actually, in the winter of 2023, um, my disease became much more widespread, and none of the previous treatments were working any longer. And that's when we started the discussion of CAR T cell therapy, which is what I wound up having.
But just to talk a little bit about, you did have some good success with some of the treatments that in the run up to that. I think you told me that the RVD therapy, you were in remission, was it for 7 or 8 years?
Yeah, 7 years. That was quite remarkable and unusual.
Yeah. I mean, one of the things that you educated me about that I didn't know is that, multiple myeloma is classed as incurable. It's sort of you manage the disease progression. You kind of, as your doctor said, keep your powder dry to at each stage to try and be able to beat the cancer back for a period of time. But that is a standard of care, and the what you write about quite poignantly in your book, which you've called "Exercise in Uncertainty," is that uncertainty of when will it pop up again? How long will this set of interventions last? Where am I in my progression? Trying to wrap your head around something that is incurable and living with something that you know to be incurable for now 20 years. Tell us a little bit about, what it's like to be living with that kind of uncertainty.
Yeah, it's interesting. I One of the things I began to realize as I thought about writing the book is that myself and other people in similar positions, whether it's with multiple myeloma or other chronic illnesses that have seen some of these dramatic treatment advances in the last decade or two, is that we live in this weird sort of limbo. And I came up with a term for it I call cancer zombies. Zombies are, as we know from the movies, half dead and half alive and doomed to be that way forever. Cancer zombies, as I've, coined the term anyway, are half sick and half well and doomed to be that way forever. And that creates all kinds of fallout across your life, your physical health, your mental health, your family, your relationships, your career, you name it. But one of the most interesting, I guess, and challenging things that cancer zombie situation creates is this idea that you have to live with this uncertainty forever, that you have this sword hanging over your head at all times. And so I did quite a bit of research into that. And I wound up speaking to a woman who sort of has made it her career to study this. She's a sociologist in the University of California system. And I learned some fascinating things from her. One is that basically humans are terrible at dealing with uncertainty. So there's a landmark study in her field where they separated people into two groups and told them that one group would receive a small electrical shock and the other would not, but they weren't told obviously which was which. And a huge majority of people, I don't remember the exact number, just told the people conducting the experiment, just go ahead and give me the shock. They couldn't tolerate the uncertainty. And it
Right.
was fascinating finding, people are basically saying I'd rather have the bad outcome than not know. So that
Hmm.
shows you how much we don't like to be living with uncertainty. So
Hmm.
then I asked this woman, okay, so what can we do about that? And she suggested a few things, simple distractions, obviously, what anything we would know common sense wise, to take your mind off things can help. She said, but the most effective thing is to really engage deeply in some kind of activity that pushes all the other thoughts out of your mind. And that can be all kinds of different things for different people. I like to fly fish. So for me, that's fishing. For other people, it could be yoga or baking or knitting. It doesn't matter. Whatever it is, as long as you engage your mind fully and deeply, it tends to push out those anxious thoughts that, get into your head. Um, but even that, I said to her, you're the expert in this, how do you deal with uncertainty in your life? Because of course, whether it's an illness or anything else, we all deal with uncertainty. It's not just related to, people with serious illnesses. And she actually said, not very well. And I said, well, that's depressing. You're the expert. And she said, but she did say something I found extremely helpful, which is just knowing that everybody wrestles with this and that it struggles with it and that you're not alone. There's that great quote about literature teaches us you're not alone. We're not alone. That's the sort of same effect here. Just knowing that it's difficult for everyone often makes people feel better, that they're not the only ones who feel they're not good at dealing with uncertainty.
You also talk quite a lot in your book about the impact that this uncertainty had in your relationship with your wife and your children and your career. And I wonder if you don't mind just sharing some of those details, because I think your book really, for me at least, brought home some of the say cancer is a family disease, or there's this kind of phraseology that gets used. We think a lot about the individual themselves who's impacted. We think less about those people around them who are impacted.
The sort of Hollywood version of this sort of thing with your spouse or partner is that, that person is this Florence Nightingale type figure who comes to your rescue and is there to meet your every need, and that you are this incredibly grateful, person that, is awed by the kindness and consideration of your partner. Um, in my case anyway, and my wife's, it wasn't that way. It was much more complicated than that and difficult. And what happened in our case was, my wife was absolutely there for me and absolutely helpful in every way. But these quiet resentments began to sort of build up. For one thing, she was a new mother of a very young child and a working mother at that. She had more than enough on her plate to begin with, let alone to have to deal with what she was dealing with a partner who had just received a very serious diagnosis. Um, to make things more complicated, she had lost her own father when she was very young. So, there's that joke about, we marry our fathers or mothers. That was not what we meant in this case, in our case, and that suddenly she was faced with the prospect of, reliving what frankly had been sort of the worst nightmare of her life to that point. And that made her, I think, frightened and tentative about being,
Understandably.
exactly in this situation again. For
Mm.
my part, speaking of frightened, I was terrified and angry and anxious all the time and short tempered and not always appreciative of her help and sort of expecting or wanting. I think when you receive a diagnosis this serious, I think, again, it's only natural that you feel somehow that you're entitled to everybody else's sympathy or time or help. Um, and when that wasn't everything I wanted it to be at all times, I could become angry about that. Now, neither of us were terribly conscious of any of this at the time. What was basically happening is we just started to grow apart, and became our relationship became colder and colder. And more distant until finally we had the last in a series of just huge blow up fights about this whole thing, and wound up deciding that we need to see a couples therapist. And that person was extremely helpful in helping us understand, excuse me, a lot of the sorts of things I was just talking about, where our own anger was coming from, where our own detachment was coming from. And once we began to understand that and see that the other person had nothing but good intentions, even if those got derailed along the way by all the things that can derail us as humans, emotionally, we began to be more gentle and forgiving toward each other. And that began to bring some of the warmth and closeness back to our relationship.
Yeah, it's so important, I think, to understand that and think about that because I think as caregivers, um, you always want to do the best for your partner, regardless, even if you're not in a caregiving situation. But certainly in that instance, but real life also continues, and you had a young child, as you said, and she had responsibilities to the child, and then ultimately had a second child, which we can talk about, and so as well as a taxing career, and so that balance could be very, very understandably taxing on a relationship. Yeah,
Yeah,
certainly.
caregiving is super hard. I think it's something we underestimate as a society, whether you're caring for an older parent or someone who's sick or, God forbid, a child. I did some research on that for the book also, and the science on that is just overwhelmingly clear that, like, caregiving is incredibly stressful. It has effects on people's health. It has effects on people's mental health. It has effects on their overall happiness, even on their income. People have to pull back in their careers because they're heavily involved in caregiving. It's really an extremely challenging role to have to play.
Yeah, and a feeling of powerlessness of being not being really able to help other just in support, and
Yeah.
you can't fix it, and we all want to try and fix it
And
for
another
our
big
partner.
feeling that comes up a lot in the research is guilt, that, why am I angry or feeling overwhelmed when it's this person who's dealing with the more serious issue? And my
Yeah,
wife, often experienced that and has talked about it. But, what I've come to see is that everybody's stuff is their stuff. And, if that's the burden you're carrying as a caregiver, it's just as legitimate as the burden anybody else is carrying.
yeah, no, absolutely. So take us back, if you would. And I think it was last fall you mentioned, was it the fall of 2024? You sort of had the discussion about the potential for cell therapy or CAR T therapy with your clinicians. Tell us about that. My guess is, well, you no doubt are now very educated, but probably even then were very educated about all the different treatment options available to you. But I think if we walk down the street in your hometown of New York City asking people, do you know what CAR T therapy is? We might get a 10% hit rate at best. So what was your kind of experience of having those discussions with your clinicians?
Yeah, incredibly enough, just for the record, not that it's terribly important, except that your audience might want to know exactly sort of how long it's been since I had the therapy. It was actually the winter of 23 when it first came onto the table as an option. And interestingly enough, I didn't know a great deal about CAR T cell therapy myself, even though I'm a pretty educated myeloma patient after, at that point, 18 plus years of living
Mm,
with this illness. I had seen a couple of webinars on some of hosted by the Multiple Myeloma Research Foundation, which is one of the big advocacy groups, if not the biggest, in this field. Only a few months before about it, and they had sort of touted it very responsibly, as a not as a miracle cure by any means, but as a very exciting new therapy. I watched that webinar, and it was actually a webinar about CAR T cell therapy and bispecific antibodies, which some of your audience might be familiar with. Also, is
yes.
another very cutting edge therapy for many of these, particularly blood cancers, but some other cancers as well. I thought, it's good to know about these. I'm gonna file that away as one of the things that's so valuable to any cancer patient is hope. And anytime you hear there's a promising new treatment, it's extremely valuable. So I, on the short term level, felt good to know that there were some new options on the horizon, and on a longer term level, was had become aware at that point that these were options, that could keep me going. Then the winter of 23 came along, and as I said, my illness progressed pretty dramatically, and I. Uh, Saw my oncologist about what to do next, and he said that the two best options at that point for me and his judgment were either CAR T cell therapy or bispecific antibodies, and in his judgment, CAR T would be the way to go. Um, Again, I'm still relatively young, and one of his goals for me was to get me, as he uh, termed it, CAR T for me could be a one and done therapy, in that I wouldn't need a lot of maintenance therapy afterward. For a time, yes, but not ongoing indefinitely. With many of these other therapies, you're having IV infusions every month, every 2 weeks, sometimes every week, and I've been through all of that many times. And he knew how burdensome that had become for me. I It had been years and years of being on weekly IV therapy, which is, needless to say, not something you want to be doing if you can avoid it.
Right.
Uh, so that was very encouraging to me. And he also, even more encouragingly, noted that he had a couple of patients who had been involved in some of the early CAR T cell therapy trials who had been cancer free for coming up on 5 years. And in one instance, he was nice to point out, the patient had been far sicker and far older than I am. And that was all very encouraging to me also. So that's sort of how we decided to go that route.
And you obviously live in New York City, so you have proximity to many of the best doctors and cancer centers of the world, Sloan Kettering and others. I think your specialist physician was in Boston, where there's a lot of great physicians there as well. I've recently read some data demonstrating that there's, let's say, a lack of knowledge amongst most community physicians. There was a piece of a data point that I read that said 66% of community oncologists believe that CAR T cell therapy was too risky or too new for them to be prescribing to their patients. These therapies have been around for the first one since 2017. You know, what was that kind of discussion like with your clinician? Did you have doubts about it because it was relatively new? I guess in the fall of 2023, the multiple myeloma products, Abecma and Carvykti, had been around for a couple years. 1 to 2 years maybe. Was there any reticence on your part to go that route, or on his part potentially to prescribe it?
I would say, in large part, because of what you said about me being in a city where I have access, and believe me, I appreciate and I'm grateful for that every day, to really world-class medical care. I would say, while my doctors were certainly extremely responsible about laying out all the risks, and as we know, these are risky therapies in the scheme of things. They don't come without very serious risks. Um, while they were very careful to be direct and honest and thorough about all of that, they weren't overly apprehensive about it. I think they'd seen some good outcomes. They had more experience with this and were probably more accustomed to using cutting edge therapies of all kinds over the course of their career, they seemed quite confident that it was the way to go. And that, I think, in turn gave me confidence, as so often the case. None of us are doctors. Well, very few of us are doctors in the scheme of things. So you are at the mercy of your doctor's judgment. And I was very fortunate to have outstanding doctors. Um, in this particular case, I had been seen by a wonderful doctor in Boston at Dana Farber Cancer Institute for many years, named Paul Richardson, and he was the one who said to me in the winter of 23, I think you need to see somebody in New York now because you're going to be treated, I think, with this CAR T therapy or something similar, and you're going to need to be in the hospital. It's a much bigger deal than anything you've
Right.
been on so far. It makes more sense for you to be closer to home. So
Hmm.
he referred me to somebody he knows who I had actually seen here once before, another wonderful doctor named Sundar Jagannath, who's at Mount Sinai Hospital, which is another leading myeloma center here in New York. And that's where I had all this done. It was Dr. Jagannath who uh, I was just talking about, who seemed very confident that this was the way to go. And then, of course, with something this big, I checked with Dr. Richardson also once I had had that consultation, and he agreed completely as well. That gave me a lot. I trust both of them very literally with my life. And so, that gave me a lot of confidence that, while I understood there were risks involved, that it was my best option.
So once the decision was made, tell us a little bit about kind of the process. What happened in the lead up to the therapy. Kind of the apheresis process where they harvest your T cells. Give us a little bit. You can probably go into a level of detail one layer down for my audience to be very curious about some of the nitty gritty details.
So, as you know, it's quite an involved process.
It is, yeah.
Starting with the apheresis. Interestingly enough, I had had an apheresis almost 20 years earlier when I was first diagnosed, because one of the frontline treatments for myeloma is a stem cell transplant, and they harvested my stem cells at that point. Um, and it turns out I have not had a stem cell transplant yet, though that's still an option for me, which is fairly unusual. For many people, stem cell transplant is the first line of therapy.
Yes.
In my case, as I said, my doctors wanted to try and keep our powder dry as long as possible and not use a treatment that aggressive until I needed it. As it turns out, CAR T cell therapy came along between then and now, and it was decided that was a better option for me at this point than a stem cell transplant, which I can still have at some later date. In any
Right.
case, the apheresis I had had the first time, when they harvest your stem cells, often can cause a tingling sensation, almost like pins and needles, really throughout your body. And I had, unfortunately, a terrible case of that when I had the apheresis. So I was actually quite uh, trepidatious about having the apheresis again, although I was told that harvesting your T cells is often different from harvesting your stem cells, and you don't tend to have that reaction. Luckily, I didn't have that reaction. I did, however, toward it's a quite a long process. It basically takes all day, and toward the end of it, my veins were starting to give out, and they needed to take enough. They needed to be sure they had the proper number of T cells. And it was sort of a little bit of a drama of almost like a race against the clock of like, we're getting close. I think we have enough, but let's try and hold out for another hour or two. And we just made it under the wire, and they were able to get what they needed to get. That was that part of the process. Then, as you know, there are 2 rounds of preparatory chemotherapy. One called DSEP, it's an acronym for the 4 drugs used, one called lymphodepletion. The first one I had to have done in the hospital for 2 days because you need to have a round the clock IV, so you have to be hospitalized for that. Um, I had been told that that often makes people feel quite sick. Luckily, it did not make me feel terribly sick. I did fine with that. Wasn't any fun to be in the hospital for 2 days, but that was relatively painless. Um, I had also been told that the lymphodepletion is usually reasonably well tolerated. I had the opposite experience. That was actually quite difficult for me. In fact, that was done on an outpatient basis for 3 days in a row leading up to just immediately prior to my hospitalization. And I had that done on a Friday, Saturday, Sunday. No, I'm sorry, Thursday, Friday, Saturday. They give you a rest day on Sunday. And then I was due to go to the hospital on Monday to have my CAR T infusion. I was so sick that Sunday, I wasn't even sure I could get to the hospital on Monday morning. The kind of sick where you're like crawling on all fours just to get to the bathroom. And I don't know how I did it really. I just woke up that Monday morning and knew I just had to get to the hospital one way or another. So, and my wife, of course, was there and extremely helpful. So we got there and things got underway. Uh, the experience of the CAR T cell therapy itself is 2 weeks in the hospital. You need to be monitored very closely for a couple of the most serious side effects, those being cytokine release syndrome, which is an autoimmune response sort of gone haywire, that can be extremely serious, if not fatal. And the other being various forms of neurotoxicity, which can also be extremely serious, if not fatal. And you're monitored extremely closely for both of those every day. Your vitals are taken constantly. The neurotox issues are monitored by asking you a bunch of questions and having you perform a bunch of motor skills, small and large, to be sure that you're not having any of the symptoms of either of those reactions. And if you are, they jump on them right away.
Do you remember the amount of time between when your T cells were harvested and when the infusion was? About how many weeks it was?
Yeah, it's a good question. I don't remember exactly, but I believe it was about a month, no more than 6 weeks, which is a long time actually when you're, not doing well. And I was quite sick. I had multiple lesions in multiple places. I was in quite a bit of pain from those lesions. Myeloma lesions can be painful. I had some in my ribs, I had some in my hips, I had some in my spine. And, so you're eager to get going. And that is one of the things, if I'm inferring maybe one of the reasons why you're asking that question, that is, I guess less than totally optimal about this process. Not that I'm not extraordinarily grateful for it as it is, but that in the future, maybe hopefully someday could be improved, is that time that it takes to manufacture these products is, a difficult period. You're anxious to get going. I mean, one of the things I've learned over the years, having been diagnosed and re-diagnosed, more times than so many times I've lost count, the time you feel worst are when you're in limbo. The times you feel best are when you're finally doing something. So even though
Mm,
I knew this was going to be a difficult treatment, I was really eager to get going. Once they tell
sure.
you need it, like let's do it. So
Yeah.
both physically and emotionally, that was a bit of a challenge that month or 6 weeks.
Yeah. In the industry, they call it vein to vein time from the time they, have the apheresis
Interesting.
process to the
I
time they
hadn't heard that.
reinfuse. Yeah. Vein to vein time. So it is one of the things that as an industry, we're very focused on shortening for all the
Yeah,
reasons that you said. And not only shortening the time it takes to physically make the product, but the transport times and potentially even bringing the opportunity to make the product into the hospital or nearer to the hospital so that the 3 or 4 days it takes on either end to travel to the various places it needs to go are shortened because that is a high stress and also potentially for very sick people a very risky time as they wait for that therapy.
it's interesting you bring that up too. Just to tell you a funny story, because and I tried to introduce some humor into the book in a number of places as well, because you know. Uh, as serious as all this is, you've still got to, laugh sometimes along the way, or you go out of your mind. Um, I remember thinking after the apheresis, and I even asked the technician, it's like, so how does this, you've just spent all this time, and all this procedure, and as I said, mine kind of went down to the wire whether it was even going to work at all, and it's not a small deal. It's like, so how do you get these, T cells now over to the manufacturer? And she told me about the process and the messengers and the extra security and everything. I was just like, all I could think about for 3 days was like, just please don't get in a car accident or misplace the stuff, or it's just like, so even that very analog sort of step in the process is worrisome for patients. It is.
Yeah, I mean it's likely that your therapy was manufactured in New Jersey or somewhere similar, not too far away from New
Yep.
York, but many of your um, similar patients in your situation, they would have to get on a plane. They'd put the T cells on a plane to go halfway across the world, and that
Yeah.
you can imagine is a very challenging supply chain for so many reasons. Timing and cost and other things. So again, another area we're focused on trying to improve. But sorry for the interruption. So just back to the prep, you were going through lymphodepletion and that piece. They were preparing you for the side effects, which I think, and hopefully this is right, that CRS and in particular is one that we've sort of learned how to handle a bit. I think there's closely monitored as you were, but also when it does happen, they're able to deal with it. So I think some of those, early patients really experienced life-threatening CRS. I just had the chance to see Tom Whitehead a week or two ago and interview him on stage at the Alliance for Regenerative Medicine meeting. And Tom, as his daughter Emily, was one of the pioneers, the very first child pediatric patient to get CAR T therapy, and she almost died from her CRS. But seems to me that we're making strides there in trying to improve the symptom management or side effect management. Um, so how did you progress, and kind of tell us about the infusion, tell us about the kind of immediate week or two after post infusion?
So the infusion, strangely enough, after all this run up and all the, prep work and all the emotional, stress and worry, is actually nothing. I mean, the actual infusion is, I've had thousands of treatments that are more difficult or where, in fact, if anything, I remember thinking, the IV bag is just a clear liquid, and it just looks like water, and it's a short infusion. It's only a half hour or so, if I remember correctly. And when they were done, I remember thinking like, well, that was easy, there's nothing to it, and if anything, I remember thinking like, is this even possible that, excuse me, humans were very visual creatures. So if something looks that simple, you don't think it could be that powerful,
Yeah, you're worried it's not working because it's so
Right.
easy. Yeah.
It just seemed too easy in a way.
Hmm.
Um, and then the next 2 weeks were really, in my case, I was extraordinarily lucky. I had a very minor CRS reaction. Even worrying about it was managed, and I think this goes hand in hand with what you were saying a second ago, was managed really well, because every time I would bring it up or worry about it, they would say, that's why you're here, we're watching you super closely. If we see it, there's lots we can do now, we know how to stay out ahead of it and manage it. That was reassuring. When it did happen, it happened for me only about maybe 48 hours, 72 at the most. And it was very mild. Really nothing to complain about, low fever and some chills, but it came and went. As far as neurotox issues, I didn't have any. I actually, speaking of another funny story, you're there at the hospital for 2 weeks. After a while, if you're lucky enough, as I was, not to have a serious reaction, or any serious side effects, part of it just becomes boring, to be honest. And so I had gotten to know the nurses pretty well, and they'd gotten to know me. And one of the neurotox tests they do is they have you do some physical thing, touch your nose, raise your hands to the ceiling, touch your toes, that sort of thing. And the nurse came in to do that, and she said, "Okay, Mr. Gluck, you know, uh, touch your nose," and she touch your toes, and she said, "Raise your hands up." And I didn't raise my hands up, and for a split second, I could see like there was a little bit of concern on her face. She said, "Mr. Gluck, are you okay?" And I said, "Yeah, you didn't say Simon Says." So that was, again, just trying to make, something. And
Break the
she,
monotony a little bit.
yeah, she appreciated it, I think as well. I don't imagine it's any more fun for them to do these things 100 times a day than it is for you to do them as a patient. But all jokes aside, I was incredibly fortunate to get through that 2 weeks. Relatively unscathed. Again, not the least bit of fun, and not something I would recommend to anybody if you can possibly avoid it. But all things being equal, it was relatively, manageable for me.
So tell me about that period post. So you left the hospital after a couple weeks. Were you able to go straight back to work? Kind of how does the reentry period post that kind of significant intervention work for people like yourself?
As you know, there is a quite a bit of damage to your immune system that comes along with CAR T therapy. So luckily, I was working from home at the time. My office during the pandemic had gone fully remote, so I was able to go right back to work. In fact, I worked through the whole time I was in the hospital.
Wow.
And sometimes people say, "Oh, I've mostly barely missed a day of work throughout my entire diagnosis and history with myeloma." Sometimes people say to me, "Oh, that's courageous or admirable." Believe me, it has nothing to do with that. It's just keeping my mind off things. It's like I like what I do, and that's great. But it also, in this context, winds up being a pretty great distraction. Going back to what we were talking about earlier with uncertainty, and
Yes.
being deeply involved in your work is a good way to keep your mind off of all the bad things that could be happening to you health wise. So I worked while I was in the hospital. I went back to work immediately when I came home, but I was lucky, as I say, because I was working from home. So I think, depending on the state of each person's immune system after they're done with the CAR T therapy, and obviously their doctor's judgment. I believe, if I'm not mistaken, that it is often an option for people to go to work in an office and to commute and all the rest, as long as they're careful and maybe are masked, or are not in crowded, poorly ventilated indoor spaces. All the sorts of things we learned about during the pandemic. But I believe, if I'm not mistaken, there are also people who are quite severely immunocompromised, and their blood counts don't come back as rapidly as their doctors hope they will. And sometimes that recovery period is longer for other people than it was for me.
Yeah.
All that said, I have definitely had some significant fallout. My T cells have not come back as rapidly as they hoped. So I am still somewhat immunocompromised. All that said, I'm pretty well off, and I now actually am in a new job where I come to work 3 days a week, Tuesday, Wednesday, and Thursday. I commute, but I still wear a mask. I still stay out of crowded indoor spaces. I'm basically living the way we all lived during the pandemic. And my T cells are steadily coming back, but quite slowly. And again, all this is so new in the scheme of things that it's hard, even for doctors who have had a lot of experience with it relative to other doctors, to be able to tell you with certainty what's going to happen. And certain other markers of mine have come back super strong, better than average, I guess you could say. But this one didn't happen to come back better than average. It's coming back a little slower than average. And I still need monthly infusions of immunoglobulin, IVIG, they call it. That's another of your immune system components that can get knocked down pretty severely by the CAR T therapy. Um, and that, for some people, is a lifelong thing. But if this somehow keeps me in remission permanently, or even 5 years plus, and the worst of it is that I have to get these monthly IVIG infusions, I'm happy to make that trade. Um, and then last but not least, and again, I'm going somewhat granular here on your prompt because I know your audience, knows about quite a bit about all this. I've had some mystery symptoms that nobody really knows. Frankly, it's hard to even know if they're 100% from the CAR T or not. Um, it's hard to know if they are from the CAR T, what would be causing them. But I've had some sort of almost the same kinds of things that long COVID patients talk about, periods of sort of like very strange fatigue, like almost debilitating fatigue.
Mm.
In my case, luckily, they haven't lasted long. Sometimes it's for a few hours, sometimes it's for a day or two. I'm able to live my life, fully, but definitely noticeable change since the CAR T. They've been happening less and less, and they've been less intense when they do happen. So I think hopefully they're on their way out. Nobody exactly knows, as I say, even if they were caused by CAR. It seems like it was because I didn't have it before, and now I have it since. But hard to know exactly what's going on there. And then I've also had a lot of soft tissue problems, like pulled muscles and muscle cramping and tendon issues, and tendonitis in certain joints. And uh, again, hard to know. Some of that could just be aging. Some of that could be one of the things I learned when we hear about people's immune systems being compromised. I'll speak for myself anyway, and I think this is true for a lot of people. We think of that as involving only communicable or transmissible illnesses. But your immune system is responsible for repairing the daily damage your body undergoes and the damage it undergoes over time. So a weakened immune system, so the theory goes in this case, might be making me more vulnerable to these kinds of injuries, where somebody who might tweak a muscle or something, pull a hamstring a little bit, might get better. A younger, healthier person in 2 to 4 weeks might take me 3 months. And again, none of this is sort of scientifically proven out. It's just some of the fallout I've had that my doctors and I seem to think could be related.
Thank you for that. That details really informative. There's a couple questions. We're coming up kind of on our hour together, and thank you again for your time and joining us. There's a couple questions I wanted to end with. One is really, what was your kind of rationale for writing a book? It's no small undertaking. And just tell us a little bit about the thought process that went in. Obviously, your vocation as a journalist had something to do with that, but curious about the motivation behind it.
Yeah, I'd go back to what I said before about that quote about, literature teaches us we're not alone. I wanted to share my story and share it as honestly and, unblinkingly as I could, so that first and foremost, other myeloma patients can see that they're not alone, that other people have gone through this, and to detail exactly what it's like so that other people could understand. But also for anyone going through a serious illness, and frankly, anyone going through any kind of uncertainty. And that's where, my editor, and my agent, my literary agent, both were very helpful in guiding me to this idea that this isn't, yes, this is a story about cancer first and foremost, but it's also a story about just coping with anxiety and uncertainty of any kind, which I hope the book does effectively as well. So my motivation was mainly to help folks going through a difficult time, whether it is a cancer diagnosis or anything else, maybe make their life a little easier, or maybe help them understand that they're not alone. Um, I've been extremely fortunate. The book has done quite well, and I've heard from, I don't know how many people at this point, but virtually every day I get an email that just about stops me in my tracks, or takes my breath away, or makes me tear up, from somebody saying that, I'm very happy to say, that the book has had that exact effect, that, either they or their wife or husband or child or partner or somebody, has had a diagnosis like this or been through some other difficulty, and that, they were very grateful that I had told my story and told it as candidly as I have, so that that it had that exact effect on them, that it made them feel like somebody, we talk a lot these days about people wanting to feel seen and heard, and I think the book is making people feel that. And something I've discovered only honestly after the fact, that I'm very grateful for, is that folks like you and people in the industry are also finding it very, meaningful and informative. I didn't set out to help, I don't know, I hesitate to use the word educate, but, I guess educate people about the patient perspective in these things. But I'm finding that that's becoming an extremely valuable part of the book as well. I've been lucky enough to, talk to you and your company and a number of other folks in the industry, both about specific therapies and drugs, but also about the experience of being, I'm, speaking to one of the large hospitals here in a couple of months about just what it's like to be a patient with a chronic illness. Um, and so, to the extent that can help, make this experience a little less awful for everyone, I'm grateful to be able to do that. And last but not least, I'm donating a portion of the proceeds, from the book to myeloma research. So that's hopefully going to have a very direct impact, in the sense of, facilitating the work that you and other people in this field do. So that's kind of the gamut of the motivations.
I know our team, when you had a chance to tell your story to the Ori team during our team meeting, many of us went away and read the book. And because we're not clinicians, we're several steps away trying to build technology that will support the next generation of therapies and treat the next generation of patients. We're a couple steps away from that, real cold face experience that you describe. And um, absolutely, brought it home, the importance of our mission to enable widespread patient access to life-saving cell and gene therapies. That this is something that is relatively new, isn't yet a household intervention that everyone knows about, and we all, you and us included, want to achieve that end in the not too distant future. I think that's an ambitious but appropriate goal for all of us, and so that every patient who needs to get access to these therapies can do so.
Yeah, I have this platform and this, skill set, as a writer and author, to be able to spread the word about some of these messages, and I feel sort of a duty to do that, and I'm glad I've been able to. And then, as I've said to you before, but I want to say again, I'm just, there aren't enough words powerful enough to express how grateful I am for the work you do and all the other folks in this world. I very, very literally would not be here today without it, and I can't tell you how grateful I am.
That's awesome, and thank you so much for that. One last kind of parting question, if you don't mind. Actually, two. I'll put it into two parts. One is for the people working in the industry. Those like myself or others, researchers. People on the manufacturing floor at big pharma companies making these products. Um, what would your advice be, or words of wisdom, or just words of encouragement be for people that are facing those hard yards? What they're doing, developing these therapies is incredibly difficult. It takes often 10 years and billions of dollars to develop it and bring it to market. Can often feel like you're pushing jello uphill and not making any progress. What would your words of wisdom or encouragement be to those working in the industry?
Yeah, I mean, the first thing I just go back to what I just said to you that you're having an incredible, immeasurable impact on people's lives, very literally saving lives, and I wouldn't be here today if it weren't for that work. The next thing that comes to mind is it's not just the patient's life, but it's their whole family. I have two kids. You mentioned I went on to have a second child, um, in large part because I was optimistic enough based on all this new research and all these advancements in the treatment of myeloma to feel like I could be there for a second child who we wound up having about 5 years after my first child. And now my kids are 22 and 17. My oldest daughter just graduated from college. When I was first diagnosed, one of the first thoughts I had, and the way you start to sort of bargain with, whatever powers you believe in, was I just want to see my daughter graduate from high school. Just please let me see my daughter graduate from high school. Now I've seen her graduate from high school and I've seen her graduate from college. I'm about to see my son graduate from high school this spring. Um, the impact that the work you all do has extends well beyond the person whose life you're saving. That would be more than enough, but my wife and kids, I can tell you, would be here telling you they feel equally grateful. So yeah, I think I understand, I guess, a little bit, even though I'm not in it, how difficult and challenging that work can be. But I'm here to tell you the reward is pretty spectacular.
And then a parting thought, if you don't mind, for the patients and the caregivers, their loved ones out there that are facing a similar challenge to what you faced and your family's faced. I'm sure at times it can seem overwhelming and hopeless, but you're evidence that there is hope, and that 20 years of life is possible with some of these diseases.
Yeah, I guess two quick things. One is, I think you're, I guess what I would share with people is you're stronger than you think you are. Um, when I was first diagnosed, there was no way I thought I could handle all this and cope either physically or mentally with all the challenges that have been put in front of me. And somehow you manage to do it. That's just the way we're wired as humans. We have a pretty powerful survival instinct, and I think that kicks in. And you can handle more than you think you can. And then the second, I guess, thought I would offer is, um, yeah, really terrible things happen in life. You diagnosis, you go into your doctor's office thinking the worst thing he's going to tell you is that you tore your labrum in your hip or something, and you need some surgery, and you'll be back on your feet and doing your regular thing in 6 weeks, and you find out you have cancer, and you're 38 years old with a brand new baby girl and all the rest. That is a fact. Really terrible things can happen, but really wonderful things can also happen. And, believe me, I didn't have a ton of hope in those early days. I was pretty scared and pretty negative about my prospects, in part because I was told I might, very directly told at that time, the life expectancy for somebody in my situation was maybe as little as 18 months. And on the outside edge, maybe 3 to 5 years. That was pretty tough, news to hear. Um, but here we are, and in the intervening time, all these incredible new advancements have happened and these new treatments have come along. I didn't even realize it until I did the research for the book and had to put it together in a very detailed way. But
Hmm.
some of these treatments have come along in matter of have been approved by the FDA for use in patients like me, in a matter of months or maybe a year and a half before I needed them. So the timing has just been uncanny. And I don't, very careful not to create false hope for people. I realize there are people who are given very grave diagnoses without a lot of hope. And I don't feel it's right to put the onus on people like that. Oh, just be optimistic and things will work out. Unfortunately, that's not the way the world works. Um, that said, I do feel like, as you mentioned, I'm an example of the other side of the ledger that sometimes things do work out better than you expect, and so I would just share all of that.
Thank you so much for that note of hope for the industry and for patients who are struggling with these sort of diagnoses. It's been very inspiring. This is the third or fourth time you and I've had the pleasure of speaking. I learn something new every time we talk. So thank you so much for spending the time. Jonathan Gluck, the author of Exercise and Uncertainty, and a multiple myeloma survivor for the last 20 years, and hopefully for 20 more at least, if not more than that. So, Jonathan, thank you so much.
Thank you, Jason. I always really appreciate it. It's a pleasure talking to you.